Disclaimer: this podcast is for educational purposes only and should not be considered medical advice. Always consult with a qualified healthcare provider before starting, stopping, or changing any medical treatment, including peptide therapy. Today we're diving deep into Leuprolide, a peptide drug that plays a very unique role in medicine. Leuprolide is what's called a gonadotropin-releasing hormone agonist, or GnRH agonist. That means it works on the pituitary gland, the master regulator of hormones in the brain, and it changes how the body releases two important hormones, luteinizing hormone and follicle-stimulating hormone. By acting in this way, Leuprolide reduces testosterone in men and estrogen in women, creating what's often described as a reversible medical castration effect. But as intense as that sounds, there are important reasons why this peptide is used clinically. Leuprolide was first approved in the 1980s, and it's commonly used for prostate cancer, breast cancer, endometriosis, uterine fibroids, and even in cases of early puberty in children. The reason it works is because many of these conditions are fueled by sex hormones. By lowering estrogen or testosterone dramatically, doctors can slow disease progression or manage symptoms that are otherwise difficult to control. Mechanistically, Leuprolide starts by overstimulating the GnRH receptor, which initially increases luteinizing hormone and follicle-stimulating hormone. That surge temporarily increases testosterone or estrogen, something called a flare effect. But after constant stimulation, the pituitary essentially gets desensitized and stops releasing those hormones. That leads to a sustained suppression of estrogen or testosterone, which is exactly what's needed in conditions that are hormone-driven. In prostate cancer, Leuprolide is often compared to surgical castration, but the benefit is that it's reversible. If treatment is stopped, the pituitary gland gradually recovers and hormone levels return. In women with endometriosis, the suppression of estrogen can help reduce pain and growth of abnormal tissue. In children with precocious puberty, or puberty that starts too early, Leuprolide can pause the process and allow normal growth and development to catch up. One important thing to understand is that Leuprolide is not without side effects. Because it lowers sex hormones so dramatically, many of the effects mimic menopause or low testosterone. Hot flashes, mood changes, night sweats, headaches, and decreased libido are common. Over time, bone density can decrease, leading to a risk of osteoporosis. Patients often need careful monitoring and sometimes add-back therapy, where small amounts of hormones are reintroduced to reduce side effects while still keeping the main condition under control. In terms of dosing, Leuprolide is usually given as an injection. There are daily forms, monthly depot injections, and even 3-month or 6-month long-acting versions. This makes it easier for patients to receive treatment without constant dosing. The exact dose depends on the condition. For prostate cancer, a common regimen is 7.5 mg monthly, while for precocious puberty, the dose is based on weight and age. Research has also explored Leuprolide in other areas, including Alzheimer's disease, because sex hormones appear to play a role in brain function. There's ongoing interest in whether modulating hormones in this way could influence conditions like polycystic ovary syndrome or PCOS. However, these uses are still experimental and not part of standard practice. It's also interesting to consider the psychological effects of Leuprolide. Because hormones like testosterone and estrogen influence mood, motivation, and cognition, patients sometimes report depression, fatigue, or emotional changes. Doctors often screen for mental health risks before starting therapy, and some patients may need support from counselors or medications to manage mood changes. Leuprolide has also been in the spotlight for its role in transgender medicine. In some cases, it is used to pause puberty in adolescents who are exploring gender identity, giving them more time before irreversible changes occur. This application has sparked debates, but medically, the principle is the same. Suppress sex hormones so that physical development is temporarily paused. In terms of safety, Leuprolide has been used for decades and is considered generally safe when prescribed and monitored appropriately. However, long-term use does require attention to cardiovascular risk, bone health, and quality of life. Patients often undergo regular scans for bone density and lab work for hormone levels. Another interesting fact is that Leuprolide is not a small molecule drug but a peptide. It's a synthetic analog of gonadotropin-releasing hormone, which is a natural peptide made by the hypothalamus. By slightly altering its structure, scientists created a more stable version that lasts longer in the body. That's why it can be formulated into depot injections that release the medication slowly over weeks or months. When we step back and think about it, Leuprolide represents the power of peptides in medicine. Instead of replacing a missing hormone or simply blocking a receptor, it reprograms the endocrine system by acting upstream. This ripple effect demonstrates how a single peptide can reshape the hormonal environment in profound ways. If you imagine the body's hormone system as an orchestra, Leuprolide doesn't just silence one instrument. It signals the conductor to change the entire score. This is why it's such a powerful tool for hormone-dependent conditions. Of course, not every patient tolerates it well, and not every disease responds perfectly. Some cancers become resistant over time, finding ways to grow even without hormones. In those cases, doctors may combine Leuprolide with other drugs, such as androgen receptor blockers, to create a more complete suppression. Patients who use Leuprolide often describe it as life-changing. For some, it's the only thing that controls pain from endometriosis. For others, it extends life when battling advanced prostate cancer. For children, it gives them back their childhood by slowing down puberty. Despite the challenges, the benefits can be significant. One thing to note is the initial flare effect in prostate cancer. When testosterone briefly rises before it drops, symptoms can temporarily worsen. Doctors sometimes prescribe anti-androgens for the first few weeks to block the surge. It's a good example of how understanding the mechanism helps clinicians anticipate and manage potential risks. Over the decades, Leuprolide has also been studied in fertility treatments. By suppressing natural hormone production, doctors can take more precise control over ovarian stimulation in women undergoing in vitro fertilization. This allows eggs to mature more consistently and improves the chances of a successful cycle. Financially, Leuprolide can be expensive, especially the long-acting forms. Insurance coverage varies, and costs can be a barrier for some patients. This has led to development of biosimilars and generic versions to help improve access. In the bigger picture, Leuprolide shows us how peptide therapeutics can reshape healthcare. It's not just about supplementing what's missing, but about strategically suppressing or modulating systems to achieve a therapeutic goal. This principle is now being applied in many new peptide drugs under development. As with all peptide therapies, the key is balance. Too much suppression can harm bone health and quality of life. Too little may fail to control the disease. Doctors walk this line carefully, adjusting doses and timing to fit the patient's needs. So to sum up, Leuprolide is a powerful GnRH agonist that suppresses sex hormone production. It's used in cancer, endometriosis, fibroids, precocious puberty, fertility, and sometimes gender medicine. It carries risks, but also life-changing benefits. And as a peptide drug, it demonstrates the potential of targeting the endocrine system with precision. Disclaimer: this podcast is for educational purposes only and should not be considered medical advice. Always talk with a qualified healthcare provider before making decisions about peptide therapy or any medical treatment. Thanks for listening, keep learning, and stay curious.